Hi, I'm Dr. Liz Cruz, gastroenterologist in Phoenix, Arizona. Thank you so much for joining us as we continue on the Disrupting the Medical Industry series. Today, we're going to talk about Imodium, which I'm sure most or many of you have probably heard of. And then we're going to talk to you about a more holistic, better approach to diarrhea. Because if you're familiar with Imodium, you know that typically this is something that you can buy over the counter for diarrhea. Now, if you're having diarrhea that all of a sudden has come on, and let's say now you're going into day 2, day 3, and you're still having diarrhea, it's very possible because within those few days, typically we would call that acute diarrhea. And maybe it's because you ate something bad. Maybe you got a little bug, a little virus, and so it's caused some diarrhea and your body is just trying to get rid of that. The goal is that hopefully that would slow down and resolve and you would go back to having normal bowel movements. For some people, that's not the case. Some people continue to have diarrhea and then we'll go to the store and they will buy some over-the-counter Imodium, which is an anti-diarrheal medicine. Imodium is loperamide hydrochloride. It's just the generic name for this medicine that is made to help slow down diarrhea. And it's okay if you're going to use it for just a short period of time, just for a temporary fix. But in my opinion, this is not made for you to continue taking it. And the reason being, if you're having diarrhea and you don't understand the cause of why you're having diarrhea, then you need to be evaluated and you need to be worked up, okay? Because you want to make sure that the diarrhea isn't being caused by some form of a chronic inflammatory condition. For example, Crohn's disease, ulcerative colitis. Those are things that you want to make sure you're not dealing with. You want to make sure there's not something else more serious. I will tell you that in my career, I have had a handful of times where I have found cancer in someone whose only symptom was diarrhea. It's definitely not the typical symptom or the typical thing that we're looking for when we're thinking that someone could have cancer. I mean, diarrhea would not be the typical, but I've had a handful of patients who had diarrhea and then I get in there and lo and behold, they have a tumor. So you definitely want to get worked up if this diarrhea is continuing. I mean, we're talking about going on now for more than a week or two. An acute bout of diarrhea is going to last typically a few days, and then you're going to start getting better. I mean, it may be slowly, but the goal is if it's just acute and it's going to resolve, that it is going to resolve and you are going to start to get it better over several days. When it's continuing though for a few weeks, now you're dealing with chronic diarrhea and you definitely want to get in, see a gastroenterologist, get worked up. The other thing with Imodium, because it is an anti-diarrheal medicine, meaning it's going to slow down or stop the diarrhea, sometimes people will end up getting constipated. So now you're dealing with the opposite spectrum of what could happen with your bowel movements. Now you've gone from having diarrhea to now you're constipated. I've had patients who took Imodium and then developed such severe constipation to the point of having severe pain and not being able to go to the restroom for days, who ended up in the emergency room. So you can go from one spectrum to the other. So you have to be careful because, you're taking this to help the diarrhea, then you get constipated. So then you take something for constipation and then you're back to diarrhea. I mean, it's very common for me to see patients that come in who will tell me they are taking something for constipation, then they get diarrhea, then they take a little Imodium to calm it down, then they get constipated again, and vice versa. And they just go back and forth like a ping pong. And that's definitely no way to live your life. I mean, there's little quality of life with that because basically you have to be tied down to a restroom no matter what you do. And you are very limited in what you can do because you never know which one you're going to have on that day. So Imodium is a great medicine to take for a short fix if all of a sudden you've gotten some diarrhea and it's been a few days and it's not getting better. Okay, fine. Take it for a few days. However, I definitely would not recommend that this be something that you continue to take indefinitely for months and even years. Because if you're having diarrhea to that point, you've got to get checked out. See a gastroenterologist. Now you may be asking, okay, well, what else can I take that would help me? Once you've seen a gastroenterologist and you've gotten worked up, and you'll most likely get a colonoscopy, maybe some stool studies, some blood work. Once you've had your workup and everything is fine, there's no cancer, there's no chronic inflammatory disease, anything else going on that would explain the diarrhea, then at that point is where you have to start trying to figure out what's going on. What I have found to be the case in a grand majority of my patients through the years from doing this for so many years is a couple things. Number one is an imbalance in the microbiome, in the bacteria in your intestine. And the other thing is that a lot of people are not digesting food well. So when they're not digesting food well, food ends up sitting in the stomach, it ferments, it putrefies, it causes gas, bloating, not to mention it could cause a lot of issues with reflux because it's just revving up the acid because your stomach knows there's still something sitting there. But by the time that food goes through, it's basically like fermented, putrefied food, and it can cause diarrhea. So the combination of not digesting food well and the combination of the bacteria balance being off really can create a lot of havoc in your colon and your intestine and can cause diarrhea. So a simple fix to that would be probiotics, which are good, healthy bacteria. And in this formulation that I created, you've got 6 different bacterial strains. You've got millions to the billions count of each of these. Okay, there are no fillers, no additives, no artificial flavorings. This is just pure, good, healthy bacteria and also a little bit of food for the bacteria. Here you have the digestive enzymes, and these are going to help you digest your food, proteins, fats, carbohydrates, even plant foods. These enzymes are all in a capsule, and this is what's going to help you. You take these with your meals to help you digest your food. So the combination of probiotics for your bacteria, for good, healthy bacteria, and digestive enzymes to help you digest your food. These two have helped so many of my patients and clients be able to get rid of the Imodium and to help their diarrhea. So I'm going to include a link on this video so that you could go right now, click that link and order your bottle of enzymes and probiotics today. Thank you so much for joining us.